watching Ayit TV, empowering you.
Amazina ndi Ryan Agawa Nelson MJF kandi club president wa Lions Club of Kabale. Ngenda kubakira muri gumwanya gwa Kabale kendo kusima abantu ba Rugarama hospital kuwasa kuhisa abantu buhereza hihi. Ikenka Lions kwehiriyo kuhereza abantu buhereza kandi twinampa heji project ya Lions Comprehensive Eye Care ujya kutiyaba abantu bitu abinobwe bwamisho kugira ngo base kwegwamo mwene rizo batwina hampaha ibindi bicuncu inza kushaba ibicuncu bijya hampaha ibya Kabale bibase kwimuka atabirebe stand up for recognition. So abone bamwe bake abasa kwija kugira ngo abene ko rizo bahanuya turi kuronshinga ubwo mukoro westamire kandi twina hampaha Lion kakwikire brother MJF wakuriye G project nira narago mu club yambarara niho gwemba hogwe kandi we chairman we G project ngeni nza kushaka kugira ngo ayike hihi kugira ngo abase kubakuraho kandi kwamanyisa binji bikwatine G project otherwise niba bari munonga ikwenda kubakira kandi namwe mwatahire bwase kugambira abandi bantu byatunga ubuhereza kandi no kubeta kugira ngo mwije mu joining Lions Club tubase kuhereza abantu umuryango byitu twatwe kumwe turi binji tubase kuhereza kusingayo kwatije umuntu umwe mwebare mukama balinde mukama wanje president we wale kunchiriza bwambara aha umucanga cyawe Reverend wa twebembero omushara abakozi birwa eri abatwikirize kora nimwe abitwije kuhereza obuhereza nimbakira omwanya ogo nimbakira mu izina rya Lions Club International Foundation kandi na no mu izina rya ba Lions Club ya Kabale na ne yambarara eriyo ne implementinga egi project omwanya ogo habwa kitwaronze Rugarama tukajironda twatwineyo project endijo yahwire yamazire myaka 3 nyuma konka twatoreta campus kunuya tubareba uburwire tubajyanga umuze kuzankayi muzembara konko mbantu nka 12 twaberize mbara kino wizireyo twizeye kutwabuza bagera ngo mbara ntare ngo buhereza n'ubwenda kuzankayi hina abantu mbwene cyo twizire nkayi nicyo twizire Rugarama kandi Rugarama ekatwikiriza tukagera tukakora kuno ubu buhereza buryo muri Kigezi region yonka Rugarama turushoka Nyakibare Mutorere Bwindi community ndijo and Kambuga nugama rwa gutora event director ntukoramo mwahura ngo n'abarayanzi haza abamwe n'umutina kujoininga clubs nkezi ngo neza abagiga konka turuboro mbweno kandi ni wowe no mutuma go kwereza umwe muri mwe tinkureba muki tinkureba mworo haza aba bantu abacara n'aba mamwari baha buri mwaka no baha akasente bakohereza a headquarters netu tugira nkekizo bucyamisho nke kutwatugizire kuno mu Kigezi region tushaba yakasente umutwaye herize zigizira zita zijaye mbo wareba bakoraho okutwarza hamwe nibaza kwa babiha hagati y'emitwaro 15 na 20 kurigira okorwire konka ko kwijambaro mwirwaro n'uburabe bya government nibakwiheraho emitwaro nshanju na no koyongera nkayi okuyongera higo ati ezo sente zo bakubihaho nubwo buntu bwo kubakozeseza konka ba doctor project niyo kugereta niyo kubashashura kandi oshashuriraho nogwe nanye akasenta kutugereta akutwayo ngwencho twetera abantu bingi mutujoyininge tubase kugereta kwereza abantu kweyongera kandi kwereza kunu yayonga tukujana no mu Uganda yonka abari India kwa kugira ekizubu tuzayo abo kurga kantu nk'ariyo mu emyaka nkesha to hatera yenjara mukareba ntwara yeki emberi kugira ngo sente tukazurundana tukashaba kuri kuba tugize leta tutira akasente kake ngwe twabe ntushaba no basa kujya tinkuzere tincho basa kuzo muryeyi konka no shango ino mwana waherire no bwakubar kampara ariyo club ze zindi nabasa kujya iningiro kwe konka ije leta tubase kuhereza abantu obuhereza okuba twintu hakasenda kutwasa kugera ta kwereza kuyamba abatahi bito abakwibata kwasa kushikwachi obuherezo nashemerwa munonga bwo kugira tutireho mweto bwo kugira ngo abantu bije tubakoreho konka kunakera habuye bwashaye mwene tweka ece nashango ko mukordo nahurira nagira nta natina najya ntabarugarama twabahaki twabahumura gwa mani konka nico cyurunja abo kugira ngo obuhereza bwabutaho katwi nabo kubasa kubakoraho ba doctor mukorebo no ba specialist mu region nabo tubashabire mukatarati ebiro bishatu mukija mukatuyamba a project nkwe tukora mbweni egiyo ninye kundire tukujya ngo nubashashura umushara na ba doctor batwakubintu babasa kugera ata kubashashura wa mushango mu kiriniki na no kumumsi yakujya kamara kunebero bina abo kwa bamwe bakijorwa mukaga batandika kureba ki kuba screeninga kuyanywa baragire bata abarakore mbwenu ntwenda kubasima barugarama kutwicereza kwija gukora nimwe katwehire yo gukora nimwe uko azarugarama egitwinobuza enobuzarebwa man na Lions na nece kizimbe cy'umurumweki tukombe kwe sente z'aba Lions abamwe bakafakare ko kanece nito twatire heki ece kizimbe mbwenu kandi ntubashaba mugire muta mukerebereje nabakushaba akasente ngogera kuwatayo kateyo umwe bakayongeraho paint imwe tumukura hamwe ebintu bitashemire tine kubira ashemere mwamutahire iki akasenta ko kubasa kugera kata kurebera irwaro ryito nebyo bingi kandi endeze abarwire nimbendeze kucara kabagira ngo oje umwamara kameze nkabiri nbendaga akakureba utajya ngo nibaza ko transport ijeyo abarwire abashaho babagire bata bakurebe barebe wabugize rota utakizirege ahubwo nimanya bine mpumo wanyu okumane kintu kigumire okurebere mpumi nekintu kiziresta kigumire bwe twantu basa kurwana so kuma numba mwayamba bakubintu babarebera na nitwe numba mwagira muta mwatiyamba nebyo bingi kambe ndezo mukoro murungi I think MC twaza kongerayo mwe bari munonga ba Lions kandi babishoboraje kandi uko batwereka nitwiza kwangirwa munonga ninga kuganyirwamo emeremeji yabanekorwa abashaho bari kuruga kuriya aba ba Lions no batirente teka yo kugira ngo abashaho bashashurwe tikwe bo kwenda abashaho ngo obuherezo bari kutoha hano buryo mwabushashurire okuyagamba buryo bonaza ko nashashura nshanje kugaruka higuru so mwe bari munonga aba Lions twongeye tubatere mu ngaro mwe bari munonga kutumesha abasika so habwo bwire niza kushaba twatwineho abantu kabashatu abari kwenda kugira kibagambaho konka wabo takabasa kwimuka ngo ije kunu hariho shonga sakuretera akazindara hori tikwe sakuretera akazindara hori then ugambeho otugambo tuce hacho uri kurira kuruga mbwono kinakwate no buherezo bumpa nasaka bakozireho nenda kugamba uri kusima ninga hine eco uri kushoborora aha program ya mission yonko ko uri kwehurira tiko basebona abanyabo abantu bashatu abantu bashatu abo hine no shahi no kutwatwa amanyine nabo no kutandika noha na no mukikura kwanje no kutandika no mukikura ino wendo gumushita
nashemererwa munonga habwaba bashaho nyoye ndabeta bambarara nahurira bene nane kibina ngurayani zikindamanya ndabeta bambarara ngene tushemererwe munonga murareba abarwire hano uko mwashanga bari benshi tukarwara misho twaburaho kuza mbarara tubahare sente zabanyinze z'urugendo zo ziramaraho ngene kutwahurire ngo bari kwiza kuno kabare twashemererwa munonga nanye niho murandebera nizire mbarara habere hande mire konga ndi hano kandi batukozireheje banshembura nyamwazo banshembire riza banshembura ndarebera erisho rireja kubaje ndareba ndaza kukira mugeno bambe tinakirira hekiro kimwe konka ndaza kukira ngene ndashemererwa munonga kandi ndetenga ngu emyaka y'indabe ndiho tindazimanya yaba nekiro kimwe yaba n'imyaka igana tindamanya konka mugunega mwize mutukorere kimwatukorere rizoba hati nyewe bankozireho nawurira ndize naruga mu mbera nekinantarareba hati ndi kukireba ngenu kundebira abarwire bari binzi hano narantibira abantu tukarwara misho mbarara hatubare ngene cyo ndatusimira ruhanga munonga mwebare kutukoraho mwebare kwiza mwebare kututekatekaho hati habigambe ibyo bice nayongera kubeshongorera hakeshongoro nako kagufu karagira ngo bashaho beitu nitubashaba kukira beni kibasika kuguma kwiza hakiro nkeki etahika erizoba nimukeize bashaho beitu bande mwebare kutuyambaho nicece sinabashaba
webare munonga mukaka agwo kunanka agwo kuteshongora kukeshongoro urasima niza kushaba abashabo hagira baturetera ka sanitizer hariho nabwineho abantu bashatu baruga kanungu tina amababa bari mukabasheka barye ruguruko kanungu beni hariho n'abandi abo nabwine bari kuruga tisoro sake nakijwe mukikuru yagira ati mazima abantu biri tukashasha misho kuyaheke ruguruko mpa akashanga y'abantu binje ati naninjaho niye ndi kushasha ati buri turi binja bashashira misho so yateshenga na kesho ngari kusima abambara hospital bakwatanise na Lions mwe bari mununga so ondijo ori kwenda kugamba ho nitwe oza kutugambira amazina gawe then otushoborere
mwe bari mununga basebo n'abanyawo abaryaha nyine banyeta abasinguzi Jafeth you're retired teacher mwenye obuzibu bwanje ninjira uruho rwije naza kureba hare uruho rwije ntareba harahinda basa kureba kandi namaro bwire burarenga nko mwaka mwene kunaho renguwa hano yaroho gudu Samaritan zabari kwijaho mbe natebekanize kuzambarara kunka mbwe no ruhanga yaba leta hanoya mwenda basimira ruhanga munonga mwene kijaro rwo kubanza bankebera nije bashanga niyo kushemezwa urwa kabiri mbone babaho bampa appointment yo kugaruka kushemezwa n'ijoro rwa kabiri nyumwazo muri nyumwazo bantira ha theater banshemeze risho rimwe ndi kwenda kugamba kitari cyo nyewe risho ribashemeize tinkagira ngo riboneire aho kuba hatiya ukuryabere ririnda reba ry'abawasi ritarareba kuko ribere rirareba mwe tinamanya yaba konka cyina masiko kugira hakwana Yesu buyabere na atamba akaba tari kutambiraho abamwe abatambiraga bakiriraho abamwe batakiriraho mwe cyina masiko ngo ruhanga ari kuraba mu batambi beitu abarayereza bundasima munonga kandi n'abashaho abo bari kwesa nkira masiko menji ngo niza kubaje mwe nuko wishimwe mu kuya abeshingorera keshongoro nyabura mutamariraho tucyabetenga turi benji kandi nabandi bacyayo yongera kurwara kandi ruhango batiremo kitekatekwe cyo kutambira abantu nimwe good samaritan zaberi izoba mwene mbwene mugumizemo nyabura mutarekeraho mukama abongere migisha kandi abahamani ne sente nyinji okugira mugumizemo mutambira abantu be mwebare munonga
so we bari munonga twayakira no bujurizi buri ku rugoa bakwetoha ya face yawe bari munonga konka ineki yagira ngo yareba kandi akaho kayiyongera ninga nahurira kubi kayiyongera ko konka wagira ngo okino kwikiriza hato cyari mu process kuba ari gukora huti kugira ngo nirihikaho naho ni hacari mu nko kuzimba ko harazimburukeje noza kunanka na hati noza kushanga amisho gaga cyari kutino mushana tikwe so gumisiriza byona nibiza kuterera aho baraze kusiburira tikwe kandi twena niko kiri kubanza cyaba so utare abari koraho ukahikana uba maskwaho naho tikwe no cyerezo bwire tikwe mwe bari hariho ndizo owamuheru yayenda agambire hano yahari taine songa agambire hano hari gumashita
oguni zaire skagarurayo araruga mu district ya Rubanda mu gomboro likumba omumuruko gwa Nyamabare abera ry'empumi konka hati arareba abere nagambira abantu ngo ayire akisho konka hati namesho manyane cyamuzibira kwegambira n'amashemererwa nyonge fura yeyi mbere ndamukwate mikono konka yayeho muri kanyina yaragara hasi kandi n'amaguru abishemwe amesho garakoma n'amaguru hati n'amaguru ndi kureba garagendaje mazima yasima ruhanga atine bugarukiro kandi yabone njiri yo kuza kuburira turasime kitongole okwija kutuhiso buhereza hihi kandi turasima abeshitongole abamesho abahanu nko gumwishiki twatwamuresira hano mu nyake hwere yatugambira umushana bwijwire kandi kutumuterere twabiraje ati mumurete mazima webare okwikiriza omulimo guruhanga kutereho turashaba ekitongole mazima ubwenge bwanyu bwonka ati bukaye basize ruhanga gumize mwabongera ubwenge nko buyahere surumani mugumize mu mujanjazo buhereza mu cyaro muyamba entama za ruhanga azizina rya ruhanga ribone kwimbisibwa ekitini sa kigarukire mukama
we bari munonga hati nimureba kutatungo bujurizi bwo watandikira kuwezaje kandi turongera kubwakira kandi no kubahamiza ngo iby'abashaho bariyendo bakoro kumpa nebyamani kandi abantu buyinji nibaza kugira okwerwa twe basebana banyabo so mwe bari munonga twaba tutegereze umukuru we by'amagara konka no shahine ibyamuteganisize yagizira abagenyi konka yatushaba ngo tugumizemo ebi turimo nabimanya yabihereza no mugisha yajya ngo tugumizemo tukore twamutegereza konka turi kuhendera niza kugaruka nyete abebembire emirime jimpaha kugira ngo bagire ubugambo bwa muhero batugambira then emirimo yindi egumizemo aho kwazina n'abandi bacyari kwija hina batandikire gukoraho hina bategerize so emirimo yindi yona neza kugumizamo tikwe imwe bari ateke cyako ekiriyo nkikorwaha kugira ngo nkiza kwemerera hati kuyahwaha twatungwize nk'emyanya omyanya mukage ndijo inagamba nkai inabagambira mu Kigezi region at least buri kwezi twatwine habarwiri ebyoma tubitire yo koruguru hinabashaha baryaha batendekirwe nubazagumana bagera bata nubabare yo kumukusiye namba nkabarwiri 15 ntubasa kweta okushemeza argemba aragerata abo kwa waburiyo umuntu umwe kuza kumwihambara ngo aje kushemeza umuntu umwe nitwe twenkanchigera kita ino kushara konkambuye no obuherezo obu twabutongoza okurugeri izoba wabonye no munyabuzara rwire mureta haba mukebere yana itaga kushemezubwa ubwire bwo kushemezubwa nubija kumugambira kurigera namba eiturabe tugeze esta twasi kandi twatandika tuza kutandika no marwa ragandi kuya kutwa tutandika tumara nkahe wiki yona mwahura ngo bakijo rwa mukaga batuyene babatebekana sabo kugera bata abo gukora nani imwe nambeje yaba nebasa kuremano ntubasa no kuremwa kumara okuza kushikora mukaga washanga nke yarayine inarebo ko umurya wo kushemeza bwa mwena twine habashe abantu bakushemeza abantu bashatu kandi siyeto umwe no shangeri nanche no itage kuza mu muntu umwe hati nyumwazi no shabashemiza abantu 17 18 yesterday abantu 18 abashemize erizati nkumanyavara akore inchaka ntubasa kweyongera no kusya ryari nkorwa mukaga tukiga Rugarama ho kandi ahandi bagize bata bategerize kandi kunojya ngutwina abantu bingi nani ngambana no gumusigazi nawe no wa club yitu yajya ngunanda kushoma bwa doctor bwaci bwa misho abo kwa ba doctor ba misho no bace munonga njo kurebera abantu bingi ntugirata ntuma nawazo mu marwara mingi tibine na unity yaci yaba misho amisho goga bakagatara bajwasha ngutiki konkani nyenda kusima ba Rugarama bo batura na unity yabo yaci ya misho nitwe nimwe tutahira kabasa kugiyamba mwe neco wabo ino munyabuzare okumanya ngo nashasha misho yo mwohereza ubwire bwo kushemeza tubwahoye tuzagumiza muntu gerata kushemeza kurigira program abarugarama ibaragiye bata ebarate egi project ne kumara emyaka 3 misho konkantu enda Rugarama twantorgamu ebi yagize capacity yo gumiza yo kugereta yo gumizamu neherezo buherezo bwo umurkabaro mukama abanpero mugisha kandi aba bakiryo murayino mbasagar ko umurayino mugumize mune namba zanyu kandi tushabe ngo buhereza bugire ba doctor bataraha babase kutongera fero buhereza funenke bye evano batugambara abareba mukurungi ninga abagize reki baganyirwa mukama abanpero mugisha amazina ganje nibanyita Bernard Kakushikere ndio mushomesa harimbara University of Science and Technology okakushare okukushani ni shanti kare we bari munonga Ryan Bernard mwenu twaza kugaruka mu myanya yi tukonka tugaruke tumusime tumutero mu ngaro ni wari kurira project eji mpaha kandi okubatorine Rugarama ubuherezo kuyagamba buri kwezi nuza kuba nibubaho titukigaruka kugira abantu abarategane emyaka n'emyaka bategereza bashaho hino abo inoka kibuzo cyari kwena ngo twaza kuhendera kuruga hano ogende kishoborokire hino rabuze jana birikiri enamba ze simu niturara twabahereze namba ze simu z'abashahu ba hano tikwe so niturara twazibahereze tikwe mwanwe nangu tuzibashomere niturara twazibahereza cause abashaho hitwe namba zitu mazima ziri open tutubahereza kugira ngo wenda gukora appointment nogikorera hano then twaheza tweta abashaho kino ine kibuzo kimwe cyonke cyamuhera
ati uwe waresebo niyo ndaruga mu district ya Rwanda uwetu ni bufundi nyina mukekuru wanje makamukagira ngo yaje hano ngo mwamukoreraho ubakorera harishorimo ko kari kumbuza ngo nerindi bararikora ko rimwe riri kujya bakora rikuza kuheza ngo nerindi bo yokiza makarikoraho icyo kibuzo nicyo ndende ya mwo rikora nerindi tinda cenga
so ari kubuza ngo erisho ngo mukikuru we bamukoze arishorimo kandi riri kutandika kuterera konka kuyarareba gona garente ngo akorwaho ngo barazagukoraho gona amisho bazagukoraho gona konka tati bakoreho rumwe abanze rebe kora abo bagakora mbo gona ko barakora nakabeka rukaho obera kimwe mvumi nicyo bakoraho rumwe rero kora rya cyera rya abo okuba kushazire okuba kushemeza risho niko kuba abakaza barazire bakabashemeza nogumo ino hechironda kibanza cyagera kita ombe atkucara heza kucara wahura wabaje noja no garuka hano bakeberana rindi nariyo bagera bata no barukora konga twena ngo tukoreho hagire cyabaho kabera cyumwe kempumi cyogo gumanera ishoro umwe mwanya gwagona bigera gata nicyo twanza twakora rumwe rero twije twakora we baresebo aza ivuza nanye nangu bitakanya wanje
edition nibwari rikureba nibwari rare ihumire kimwe ngati bagira ngo baranankeri ezanya nandi kugira ngo bakorere itibangambye ikiratuma batakora eri rikaguma rirare
hati cyo mpaho abashawuni barara bayongera kukushobororera naninjira obabuze nambone hino mushaho wakureba ogogo mucyara wahikayo noza kugamba nawe nakikugarukira mutikwe kugira ngo yongere kushoborokerwa icyatuma bahingu bashara mu gukora ari rimwe ritarye rindi tikwe mwe bare munonga ninjira katurugaha musire kurunji
Check. Yes, thank you very much. You who is watching AIT TV and you who followed this live. We are coming to you live from Kabare, and you just heard for yourself why we are actually in Kigezi land. Here is well, I know him as Lion. I was about to forget Lion, and I knew that was really not good. So yes, Lion Bernard Kakwishile. I understand from his engagements here, you're one of the people that are leading this project. Maybe to the viewer out there, we could get the whole big picture of the project a little bit in details, perhaps, yes. Mm.
among the in the country based on I unit at Mbarara Regional Referral Hospital.
Yes.
So people from this region, none of those who are screened and referred,
Mm.
none of them can back.
Oh,
And
that was
we
a
didn't
sad
give
story.
up.
Yes. Mm.
And we didn't give up.
Mm.
Why we didn't give up? We said what can be done? Why didn't people turn up? When we came to do a survey, we found out that they reported the causes was that Mbarara was very far. It was costly for transport,
Mm.
but also if you go to Mbarara and they work on you,
Mm.
you are admitted. The cost of staying in Mbarara was so high. So we said, what do we do? We decided to start, we wrote another grant,
Mm.
and we took it to the Lions Club International that had funded the previous grant,
Yes.
and luckily we got some funding. We decided to come and work within Kigezi region, not on diabetic retinopathy only,
Yeah,
but
this
on
time.
other diseases. So that's why we are here.
Wow. Thank you very much. Now we had a technical glitch a little bit at first. Now, if you didn't hear him say, last year they were implementing another project.
Diabetic retinopathy project. Project, yeah.
So in simple terms, you focus on one of the conditions of the eye, just one like
retina,
this.
the impact of diabetes on the retina.
So at that time, they called upon people in this region to actually come and access the services, and that was just one like
We
this.
referred them to Mbarara,
But
and out of the 126, none turned up.
yes.
And they said the challenge was the transport,
Mm.
the cost of transportation to Mbarara,
Mm.
the cost of being maintained in Mbarara in case you got a surgery,
Mm.
and the cost of treatment. So we decided to help these people by bringing services nearer to the people. So
Oh.
this project is going to be working in 6 health units or 6 hospitals.
Mm.
One of them being the one where we launched first Rugarama. The other one will be Mutorere in Kisoro. Another one will be St. Karol Rwanga Hospital in Rukunjiri, what they call Nyachibare Hospital.
Mm.
The other one will be Rushoka Health Center 4, Rushoka in Intungamo.
Yes.
Then the other one, we have Bwindu Community Hospital and Rugeyo. That's where we will be best at the moment in this region.
Okay. Yeah. Thank you very much. Now, looking at what a few people, of course, talked about, it looks like the project almost was late compared to the now. Well, that is for the lack of words, or the other word to mean it was timely and people really needed the project. Yes.
In the eye care in most of the in the health sector, it is one of the most neglected places. Most hospitals don't have even an eye care unit.
Yes.
And Kigezi has had a very big challenge with eye care.
Mm.
So bringing this service near, you can see the numbers.
Yes.
When you go in the corridors, we just, I think we only advertise, we put up adverts for this service within about 3 days. But when you see the numbers, you know that these people basically needed this service.
Yes.
And thanks to the Lions Club International Foundation and the Lions of Kawa, of Mbarara, and the Lions of Uganda, and the Lions from the district, and all the Lions all over the world from whose funds we tap.
Yes.
We have been able to render a service at Rugarama, and we look forward to working with Rugarama. Rugarama, we have had a long partnership. This hospital, if we walked around, I think you saw donated by the Lions Club International. And some of us are very proud to be associated with Rugarama and to be.
I'm going to request my cameraman to zoom out, and you need to visibly see that the windows actually bear the colors of lions.
Yes.
And slightly a few minutes ago, Mr. Bernard Kakuichile.
And if you see there, it is, I think there is
an emblem of the lions.
Oh yes.
Yeah.
Oh yes.
Mm.
So he told us they were another group behind this building. So Mr. Bernard, let's now roll into insights of the project. I understand that the conditions are not ending so soon. It is going to be as necessary as possible moving forward. Is it closing like so soon?
No, the project is for 3 years. We are almost done with the first year. We were affected by COVID.
Yes.
But the project is not going to end so soon.
Mm.
To build into the sustainability of the project,
Yes.
that's why we are working with the mainly face-based organization, because they are allowed to make a charge. Within government institutions, you can't charge patients.
Mm.
But when you don't charge, you can't sustain a service.
Yes,
So
yes.
after 3 years,
Mm.
part of the money that every unit is collecting
Yes.
is supposed to sustain the service going forward. We will no longer be sending surgeons from Barara.
Mm.
The hospital will be demanding for surgeons.
Oh,
And when the
yes,
surgeons
yes.
come here, they will have to be paying them. It is now they are lucky that
You're building their capacity.
we are
yeah.
building their capacity
Mm.
so that after 3 years, they can sustain the project.
Okay. Wow. Thank you very much. Now, while this is for people who are already, affected, for us a program that is aimed now at eye conditions.
That is one of our major activities.
Mm.
Sight restoration and blindness prevention.
Yes.
We usually go through in schools, primary schools. We do school eye screening
It's
because you
continuous.
don't need to wait
Yes.
until you are almost going blind to know your eye conditions. We try to do at a continuous level, but we need basically people who can support this.
Yes.
You and me.
Yep.
You who
And
has
him.
not and him who has not yet joined the Lions.
Mm.
Join us. The little money that we will bring in could be the one to make that service rendered to the communities where you think it is lacking.
Well, it is well understood, and we can only pray that this goes a sustainable plan, and I believe we do more than building a capacity of to be made in the region, and perhaps maybe other programs, of course, will be coming on board.
Can you empower your people economically? Because some of these diseases it is because of basically talk of poverty. Someone is referred to Mbarara and he's lacking even 100,000, even 30,000 for transport.
Mm.
If it is your father or your grandma, can you empower them economically?
It's a very big question. Of
Young
course.
ones,
Yes.
don't neglect your parents. Check on them. Check on their health so that managing a blind person is very costly, not only to your family, but to the entire community.
Mm.
So can we do something as a community? Can we do something as a nation?
Mm.
The level of corruption that is taking place that you hear of would be rendering these services to your community. And the corrupt are from
within us. Yes,
from
yes,
within
yes.
us.
True. Today we are celebrating the Liberation Day. He's calling for economic liberation, and he says you're part of the process, and we are all into this. Thank you very much, Mr. Bernard.
Welcome.
We could only say thank you, the Lions, and
Thank the Lions. Not me. I'm just a statistic among the Lions Club.
Okay, yes. This is to you, everyone who subscribed to the Lions Club, every other Lion there. Thank you for supporting this cause. Mr. Bernard, thank you for allowing to talk to us.
Welcome, ATV.
Okay. Yes, thank you very much. I told you we are still live at Rugarama Hospital. Here comes another Lion who is actually the president of the Lions Club in the region. Trust me, well, one or two comments, obviously. This is your land, and I'm told, Mr. President, we may not actually, well, okay. With powers entrusted with him, Lions. We are Lions, by the way. We need to know about this project. Okay, the president there. This is Africa. Oh, okay. He's delegating another practicing. Are you a practicing doctor? Train. Ah, okay. Okay, yeah. Yeah, thank you very much. Now, we come in your land. I understand. Well, first say hi to the viewer.
Okay. Hello
Mm.
everyone.
Mm.
Watching us.
Yes.
My name is Lan Sande Javila.
Mm.
I'm a medical student doing Bachelor of Medicine and Bachelor of Surgery at Kabale University, and I'm doing my practice from Kabale Far Hospital.
Yes.
I'm a member of the Lion Club of Kabale, Lions Club International, and we are glad
Mm.
to be part of the launch of this activity
Yes.
with in partnership with Mbara University, where
Mm.
we are launching this activity to help people with eye problems,
Mm.
and we are glad to be part of this activity.
Okay. Well, that is, of course, a pretty one. Though, when we come to the dynamics of the land, we understand, just like you told us, you are the Kaba, you are at the Kabare, you called it Kabare.
Kabale University School of
No,
Medicine.
no, 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 the hospital.
Kabale Regional Far Hospital.
Okay. You are, unfortunately, you're going to, this is going to be, you who is viewing, this is going to take a shift. We're in the compound of a hospital, and this is an ambulance, of course. Sorry about that, but we have to shift this, and that is how we get to do it. Okay, we are still interacting with a training doctor at Kabare University, and he is also practicing at Kabare Regional Referral Hospital. The major role in here, and me and to the viewer, is for you to paint for us a picture of how eye-related complications are actually being handled in the district. Yes. Mm.
Okay. Well, I must report
Yes.
that as the district, they have tried their best, having identified different people with eye challenges. At the referral hospital, we have the Department of Eyes, where we've handled different cases, different surgeries, and different errors in relation to eyes. And apart from that, as Lions Club, we've partnered always with Rugarama Hospital
Yes.
to make sure we enhance the establishment of the eye clinic by installing most of the facilities, of course, through the donations the Lions make. We donate most of those materials and see how we can employ, also equip the staff to work upon those people with eye problems. We do education, of course, health education about how uh, most of those eye-related problems come at different levels, health center force, and because of the fact that sometimes there are no facilities at health center force and in behind there, we always have advanced units at the referral hospital and also at Rugarama Hospital where we address those things. When people come with eye challenges, we always meet them through health education in the first place. We assess them, we teach them on how they come, and after assessing them, we identify those who need surgeries or those who may need the supply of optical instruments like glasses and other things. We supply them, but basically we address them through launching health education camps. We partner with hospitals like our hospital in Mbarara, which is also a project of Lions Club International, and also as students doing and practicing medicine, also do enhancement, teach people on how these problems come, how they can care for their eyes, and how those problems arise.
Okay, so apparently, this is to say that Rugarama becomes now the center for whoever has complications in the eye. This is what we're trying to build. I don't know.
Well, basically, we have the unit at the Far Hospital
Yes.
for the eyes, but like as I said, as Lions Club, we got eased to partner with Rugarama Hospital, which also had an eye clinic.
Yes.
So we equipped it, expand it, so that as well as we have a unit at the Far Hospital, but also this unit is operating so that we can handle big masses of people with eye challenges.
Okay, apart from the Lions intervention and what you would actually wish, we believe there are so many other organizations there that could actually support the Lions to bring other health-related services within the eye kind of world or field, for the lack of the scientific word. Could there be another lacking service you believe other kind of supportive organizations need to think about to bring to the Kigezi region?
Yeah, well, I must say, most of the people, not only in Kigezi but across the world, are facing challenges with chronic illnesses of infectious diseases, and also we have other diseases, basically like diabetes, hypertension. Those are, we normally call them lifestyle diseases, which the Lions, for example, have addressed. So we normally address the concepts of diabetes, hypertension through advising people to change on their lifestyles. It can be to do with feeding, regular exercises, and always celebrate it because we have like on the Lions year calendar Lions Day for diabetes. We always organize masses. We've always done partnership with, for example, Rushoroza Hospital for diabetes. We organize those camps. People come and they test for diabetes, for hypertension. And also we partner with other organizations like Rotary Club, which also is like a sister club to Lions. The only difference I can say is the name.
Yes.
So we do those partnerships alongside with other NGOs and other well-wishers who can come in and support. So sometimes when we find we need funding to have those activities launched, we always maybe ask for funding, and also in the little capacity of the Lions International to donate, we look around what is the need. If it is to do with a certain condition like diabetes, like hypertension, all those conditions, we equip those hospitals like Rushoroza, as we said, like Rugarama, we basically partner with the eyes. Then sometimes we deal with maybe hypertension, diabetes, maybe, and other related lifestyle sicknesses and diseases with Rushoroza Hospital. So we don't do it alone. We work with other people in the communities. We sometimes do education talks. We do it with students at the universities. For example, in schools, we have Rio clubs. The Rio clubs can be at secondary level and advanced level. So they also move on to do mass education about these things so that people can be aware about how those illnesses come, so that we can address. Another way they can have those issues addressed apart from going to the hospital, because we identify that lifestyle sicknesses can be dealt with by our behavior, by our feeding.
All
So,
preventive
yeah,
measures, generally.
preventive measures.
Okay, yeah, thank you very much. Now, we could, Lion Bernard talked about the cause, because when last time he says what led to this project, when last time they called on people to go to Mbarara and get these services, of course they could hardly afford that. Within the engagements that you're doing, could we be having a chance to later introduce a model that will perhaps let these people maybe kind of save for such, or economic empowerment, a few of those programs? Do you see that coming, or is it one thing that you should actually advocate for in the Lions? Could it be a message you put to maybe a funder out there?
Okay, well, thank you very much. You see, the only big challenge we have, I must say, most of the people in this world are selfish. So we always want to gather everything for ourselves. And that's why there are very few people are willing to render selfless services. So basically what we do as Lions is to call upon each and everyone in their limited capacities to jointly gather the little they can into a pool. Because even what we do, our contributions, we gather it in a pool, so that whenever there is need, we are able to help. You may not find you're able to respond to an emergency, but when you gather as a team, there is a lot you can do as a team. So maybe the message we can give people is, in their respective capacities, is to join these organizations that are willing to gather money and help. And help, we do, of course, campaign. Like now we are saying, as people think Lions are rich people, we are not so rich as they think, but we are rich in our hearts.
That is well noted.
We have
yes.
hearts for people, hearts for others. That's why even our motto, we say, we serve the less fortunate. And when we talk about less fortunate, we don't mean only this. Anybody can be less fortunate. For example, from where you can be going, and all of a sudden you fall down. At that time, you are less fortunate.
Very true.
So anybody with the heart of helping, you meet somebody is struggling, you find somebody maybe is not having water, there is an old grandparent in the village struggling, or somebody is not having lunch or supper, you just choose to sacrifice your 1 kilogram of posho and you donate it. That is a heart of lionism. A heart of not thinking about yourself, but a heart of giving somebody who is in need. That is what we do as lionism.
Okay, thank you very much. We can only hope for the best. I won't ask you how you feel about the project. I'm so sure, of course, it's a plus for
Of
the
course,
region.
I'm extremely grateful, and we promise to have more ahead of us. We don't rest. Every day we are planning to see where there is need and we cover it. That is what
Okay.
we do as Lions, and we hope that God willing, as long as we have life, we shall always serve the less fortunate.
Okay,
Thank you very much.
thank you very much. He is a training doctor, but also a lion, and we are so much privileged to have to talk to you. Now, you who is watching AIT TV, also thank you very much. We were coming to you live from Kigezi land. Twatula Rugarama, and trust me, really, quite enjoying. I wish I could continue flowing like that. But thank you very much. Today we were launching the next big project of the region, and this time it is not by any other organization or group, but the Lions. And I'm telling you, this is about comprehensive eye care unit that is being, launched today at Rugarama Hospital, but also it will also be in several other districts of the region. We're talking about districts like Chisoro. We're talking about districts like Rukunjiri, districts like some part of Ntungamo. That is what they are going to be enjoying. And these guys, the Lions, have a motto or a tagline that goes, "We serve." This is AIT TV, and this is what we always do. In case you always have such live events, or such events, then we could actually broadcast them, because the advantage is such events remain here. Now, this link you're using to watch this, the event remains there, and that is why we believe this is a better service for your event. Otherwise, thank you very much for watching. Until next time.